Hello, and welcome. Today we're diving into the world of urinary health to explore a condition called chemical cystitis. This isn't your typical infection, but a specific type of bladder inflammation triggered by chemical irritants. Understanding this condition is crucial for identifying its causes, symptoms, and ultimately, how to manage and prevent it. So, what exactly causes chemical cystitis? Unlike bacterial cystitis, which stems from infections, this condition arises when the bladder lining is exposed to irritating substances. These substances can come from a variety of sources. Common culprits include certain hygiene products like douches, feminine sprays, or even heavily scented soaps. Medications taken orally or instilled directly into the bladder can also be triggers. Additionally, spermicides used as contraceptives and even certain foods in sensitive individuals may contribute to the development of chemical cystitis. Now, let's understand how these chemicals cause the problem. The bladder is lined with a protective layer of glycosaminoglycans, often referred to as the JAG layer. This layer acts as a barrier, shielding the delicate bladder wall from irritants in the urine. When exposed to harsh chemicals, this protective layer can be damaged or stripped away. This exposes the underlying bladder tissue to irritants present in the urine, causing inflammation, irritation, and the uncomfortable symptoms associated with chemical cystitis. The damaged bladder lining becomes more permeable and sensitive, leading to an exaggerated response to even mild irritants. Regarding the prevalence of chemical cystitis, precise epidemiological data is limited. It's often underdiagnosed or misdiagnosed as other bladder conditions like urinary tract infections or interstitial cystitis. However, it's believed to be more common in women due to the more frequent use of vaginal hygiene products. Individuals with pre-existing bladder sensitivities or conditions may also be more susceptible, because diagnosis often relies on excluding other causes. The true extent of chemical cystitis may be underestimated in the population. The symptoms of chemical cystitis can be quite bothersome. The most common include a frequent and urgent need to urinate, even when the bladder is nearly empty. Pain or a burning sensation during urination, known as dysuria, is also common. Some individuals may experience lower abdominal pain or pelvic discomfort. The urine might appear cloudy or have a strong odor. It's important to note that unlike bacterial infections, fever and chills are typically absent in chemical cystitis. Diagnosing chemical cystitis requires a careful approach. The process typically starts with a thorough medical history, including a review of potential chemical exposures. A physical examination will also be conducted. A urinalysis is usually performed to rule out a bacterial infection. If the urinalysis is negative for bacteria but symptoms persist, chemical cystitis becomes a more likely possibility. In some cases, a cystoscopy, a procedure where a small camera is inserted into the bladder, may be performed to visually inspect the bladder lining and rule out other conditions. The key element is ruling out other conditions that present with similar symptoms, such as urinary tract infections or interstitial cystitis. While there aren't distinct classifications of chemical cystitis like there are for some other diseases, it's helpful to consider the severity of symptoms. Some individuals may experience mild, transient symptoms that resolve quickly after eliminating the offending agent. Others may have more severe and persistent symptoms that require ongoing management. The cornerstone of treatment and management of chemical cystitis is identifying and eliminating the offending chemical irritant. This may involve discontinuing the use of certain hygiene products, changing medications, or modifying dietary habits. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help manage pain and discomfort. In some cases, medications to soothe the bladder lining, like bladder installations containing hyaluronic acid or chondroitin sulfate, may be prescribed. Drinking plenty of water is essential to help flush out the bladder and dilute urine. In severe cases, prescription pain medications may be necessary. Prevention is paramount when it comes to chemical cystitis. Avoid using harsh or heavily scented hygiene products in the genital area. Opt for gentle, unscented soaps and avoid douching. When starting a new medication, be aware of potential bladder-related side effects. Stay well hydrated by drinking plenty of water throughout the day. If you suspect a particular food is triggering your symptoms, try eliminating it from your diet to see if your symptoms improve. Most importantly, consult with your healthcare provider if you experience persistent bladder symptoms. The prognosis for chemical cystitis is generally good, especially when the offending agent is identified and eliminated. Symptoms often improve significantly or resolve completely within a few days or weeks. However, if the chemical exposure continues or the bladder lining has sustained significant damage, symptoms may persist longer. There's ongoing research into new strategies for protecting and repairing the bladder lining. Some studies are exploring the use of specific nutrients or supplements to support bladder health. As research progresses, we can anticipate even more effective approaches for managing and preventing this condition.